Hi, my name is Sierra Jenkins. I'm gonna do a CVL dressing change today. The first thing you need for that is the CVL dressing kit, and then of course your patient. So you go in the room. The beginning of the procedure is not sterile because you're just removing the dirty dressing that was already on there. So you go in, you introduce yourself, wash your hands, you put on non-sterile gloves, and you just peel the old Tegaderm or dressing off of the CVL, and underneath that it should have a bio patch. So you will remove that with the old dressing. Then you will take your non-sterile gloves off, wash your hands again, get your kit, open it up, put your mask on. And for this procedure, you also want to put a mask on the patient because you don't want them to cough, sneeze, or anything to get it on the CVL because that could cause contamination. Have the patient turn their head away from the dressing and the central line. So if it's whatever side it's on, have them turn the opposite way. Then you will put on your sterile gloves. And then you will lay out your sterile field. You want to go ahead and initial and date the sticker for the CVL dressing because you don't want to write on the patient. Remove all the contents of the pack, swabs, Clorox. Then you will take your alcohol swabs and clean the site, removing any gunk. And you want to use one hand as your non-dominant hand to hold it because it's your dirty hand. But you want to clean the site for any residue or blood or anything with the alcohol swabs. And try to get as much as you can off with this because once you use the Clorox, you have to let that dry for 30 seconds. Or 30 seconds. So you clean this in like a circular motion, just making sure you clean it for 30 seconds. Clean down the CVL lumen around the skin. And you have to let that dry for 2 minutes. Once that's dry, you don't want to fan it or blow on it or anything because that could cause contamination. Once it's dry, you put the new bio patch on. And then that's when you take your dressing, you apply it on, pulling it tightly to secure it. Make sure the ends of the lumen are sticking out. You don't want those underneath. And then you just peel the outer tape off and place your initialed and dated sticker on the patient. And then you're all done.